So here we are in a patient with keratoconus, LenzOplastique surgery using LenzOptics to correct stable corneal irregularity with very high astigmatism, hyperopia, and we work through the lens, and you can see me being very diligent, making sure the marks match the corneal marks with the toric mark of the field technology. Very important, no matter how complex the case, make sure you're planning for perfection. Polish. And like all our patients have no anesthesia other than numbing drops, no Valium. Correct, Blake? And this is a wonderful patient from Arkansas that we're working on. Blake, anything you want to say? I'm still in your eye. Any pain, any discomfort? How's your experience?
Great.
Wonderful. So here we are in his eye. This is Blake, a wonderful patient who's traveled from Arkansas with high keratoconus. And we're doing LenzOplastique based on my principles of lens-based optics to fix the corneal irregularity. He has very high astigmatism and irregularity with high hyperopia and keratoconus. Blake, how's your experience? Like all our patients, there is no anesthesia other than numbing drops, not even Valium. Any pain at all while I'm in your eye finishing up?
No pain.
How's your comfort level, Blake?
100% comfortable.
Super. Anything you want to say about your experience, Blake, having had keratoconus and your wife being a nurse herself, coming here with all your research?
Experience been great. Exactly what you see on the videos. A very personalized experience.
Videos. Now you're part of the video. Right? Congratulations. Coming out. Blake, we're all done. How do you feel?
Feel great.
Any pain at all?
No pain.
And doctors watching is a case of advanced keratoconus with high regular corneal astigmatism where we've done a lens-based LenzOplastique surgery, and you saw me being very finicky with the rexus incision and the lens position of the premium technology. Blake, you traveled from Arkansas.
That's correct.
You've seen all these videos of my patients that I shared impromptu with surgeons. Today you're part of it. How do you feel?
Feel great. Looking forward to seeing the results. Came a long way just to get find someone to look at my eye to see if there's anything you can do. He jumped right in, a lot of technical measurements to make sure it fit my eye exactly the way it needed to be. The plan was developed just for my eye. It wasn't just cookie cutter. He took the time, 2 days in a row, looking at my eye, make sure nothing changed from one day to the next to get it right.
It's my pleasure. And for doctors, again, as you're watching, no anesthesia other than numbing drops, not even Valium.
That's correct.
How do you describe your experience? Like,
Very calm experience, no pressure. Just focused solely on my eye, solely on me. No time spent, running around checking on someone else. All time was given to me to make sure it was right.
right choice. Here's the man from Arkansas, Miss Nurse. How do you feel?
Good.
And see, no stretcher,
Yay!
No stretcher.
right?
That's right.
How was the experience?
It was good. Lay back, just sit back.
For doctors watching from Arkansas, this gentleman with advanced keratoconus, his wife's a very experienced nurse herself, right? And what we did, as you saw in the surgery, working on this keratoconus abnormal cornea through the lens-based surgery, LenzOplastique. No drugs, just numbing drops, and like anything you want to see. A lot of you come here, you'll have already seen and you'll have stalked me for years, seeing my videos of rehabilitation. Today you're part of it. Anything you want to say?
For people who've had surgery before, very rarely do you see the surgery beforehand. A few minutes. Like you said, there's no drugs involved, so your mental acuity is on point. You know exactly what's going on at all times. There's no question asked, which is a big part of for me. I like to know what's going on from the time I got here to the time I walked up the door. There's no missing time. I was involved, active. He kept asking how I was doing, make sure everything was comfortable. Knowing what was going on and being, I guess what they call it, about your faculties, was very important. And it's nice to know that, hey, there's no drugs involved. Just come in, numb the eye, and take care of business.
You want to say something from your nurse experience, what you saw? He's walking out, no stretcher.
It was a very good experience.
It's a pleasure. Come on, this way. Blake, good morning. How are you?
Doing well. How are you?
How's our vision doing?
Good.
Yes?
Yes.
I already saw that. It looks amazing. Any pain at all?
No pain.
Super. So Blake, I do this a lot, sharing with my colleagues all over the world every day, all of you patients who, as you come back for your post-op, or patients as they're landing. So today is your day one post-op. Anything you want to say, impromptu, to my colleagues who are watching?
You know, what amazes me, there's no anesthesia, there's no Valium, nothing to put you out of your senses. You're laying there wide awake, aware of what's going on, talking to you as the procedure's going on, everything's comfortable. Get up and walk out of the room. There's no pushing me out of the room. I get up and walk out of the room and aware of my surroundings. And that's pretty much amazing, because most surgeries, you know, they knock you out before you ever get back there. You transfer, walk in, get on the bed,
Stretcher, yeah.
sit up, and walk out.
Sure. So for doctors watching, also your brief history, like all of you come here after stalking me for years, researching your stuff. So brief history, quick, in a minute. Your condition, what's going on, what brought you here. Today is day one. Go.
I've been dealing with keratoconus for 7 years, really 10 years, 7 years I was diagnosed. I've had every type of lens, trial, lens, sclero, hybrid, custom. On top, lenses plus glasses, nothing would work. I was told this time last year that, hey, there's nothing we can do. But we put a man on the moon in the 60s, I had to find a solution. Everybody was focused on problems. I was looking for a solution, and I found it right here.
So the doctors watching, is a wonderful gentleman. He's traveled from Arkansas, and today is day one. We did LenzOplastique surgery, so I went inside his eye. And correct, they don't take any anesthesia, just numbing drops, not even Valium. And how was the experience? Any pain, anything while I was in your eye?
No pain, no discomfort.
No stitches, and here he is day one, already seeing 2025. This is keratoconus grade 3. And if you look at his concept, by the way, this is how he looks today. Today is day one. They took an imaging. Crystal clear cornea. Despite the keratoconus, the lens is perfect in place. The astigmatism axis is on axis, perfect right here, you can see. And that's what's corrected him down to 0. And if you look at his complete picture pre-op, we had diagnosed the lens to be slightly cloudy, despite the cone that he had with the very high 6 diopters irregular astigmatism. We planned the LenzOplastique procedure because even though he was not being corrected by anybody, he was stable. And that's the point we went by, remember? So we went inside the eye, and here he is day one, keratoconus patient seeing 2025 without glasses. Anything else you want to say, Blake, with all your knowledge? Or you brought your wife here, she's a nurse in neurosurgery. Anything you want to say besides this?
No, I think if you have patients that, you know, they hit the wall, and they're young, old, it doesn't matter. There's a solution out there. Keep looking for the solution. I found my solution here in Florida, and I'm so thankful that there's an option out there.
Look, I'll get back to your hotel, rest before you leave, all right? Careful.